name is Sneha, this is Jacob, and we're both medical students at UT. And our project is focused on understanding the utility of a student-based wellness committee. We don't have any financial disclosures. So as many of you all know, medical students often struggle to balance academics with physical, mental, and emotional wellness. Because of this challenge, many institutions have developed efforts to increase student wellness in academic medicine. The 2021 National Survey of Wellness Programs actually indicated that 93% of responding medical schools had wellness programs. And these efforts can range from institutionally implemented wellness programs to curriculum reform. But the effectiveness of these programs hasn't always been evaluated, and efforts with voluntary participation weren't always utilized by students. So one example of this is actually at our own institution's wellness committee. In early 2019, our institution established a student-led wellness committee with the overall goal of helping fellow students find outlets for wellness. And student participation in this committee was voluntary. But after 3 years, we struggled to both maintain old student involvement as well as expand new student participation. So the purpose of our project was to survey medical students to understand any gaps between our organization's activities as well as student preferences, with the hopes of better tailoring the committee to meet student needs and contribute to this existing gap in the literature. So based off of existing literature, we suspected that time management would be one of the most dominant themes throughout students' use of wellness programs, as well as students' sense of wellness itself. So we hypothesized that student preferences would center around creating more flexibility and professional responsibilities to allow increased agency with time management. And our survey consisted of 10 free response questions, 7 multiple choice questions, and 54 Likert scale items. It was created using Microsoft Forms, and the survey was circulated through email and class group messages, as well as posted in spaces around the university. The survey was organized into 4 sections based off of question topics. So in the first section, we assessed students' conceptions of wellness and fulfillment by having students define wellness and then rate the importance of different activities to their conceptions. And then in the second section, we characterized students' use and perceived efficacy of school, student-led, and community-based wellness programs. And then in the third section, we studied barriers to the use of such programs into wellness in general. And then in the last group, we gauged what students desire from future wellness interventions. So all of our responses were anonymous. And our analysis consisted of comparisons among various wellness components' relative importance, as well as a thematic analysis for open-ended questions. So in our results, we had a total of 27 medical students respond, which represents about 4% of our medical student body population. We had 9 M1s, 9 M2s, 7 M3s, and 2 M4s.
So I'm going to talk a little bit about the results and conclusions of our study. So with section 1, this was really about understanding what do students really think of when they think about wellness. And then, so we're kind of asking open-ended questions and then moving to these kind of Likert scales, 0 being sort of not important at all, 7 being the most important. So if we look at activity importance for wellness, we can see that fulfillment, relaxation, and mental rest, mental health are all pretty high up there. But also pretty much all of these items that are generally related to wellness were between about a 5 and a 6. So not a huge distinction there, except for spiritual activity, which was kind of rated a 4, the only one that was kind of lower on there. And then if we look at importance or activities related to fulfillment, we see that helping others is the first one. Makes sense. We're talking about medical students, followed by significant others, having a professional direction, things like that. And then sort of near the bottom, we see travel, vacation, ease of lifestyle, spiritual engagement, and then the lowest, local or widespread fame or notoriety. So I think from this, one of the things that stuck out to us was when we asked them about their conception of wellness, we see that relaxation and mental rest are pretty high up there, which kind of contradicts, or at least doesn't match up with this idea of their where they're getting their fulfillment from. So if you look at the bottom of the fulfillment graph, you see travel or vacation, ease of lifestyle is not incredibly important for their fulfillment. So this kind of begins this sort of theme of students sort of valuing their professional achievement more so than their actual wellness. In section 2, we wanted to see how students perceive the efficacy of these different programs, specifically compared to their personal efforts, school-run, community-based, and student-run programs. And we found that students really report that their professional responsibilities are quite overwhelming and leave them little time for personal well-being. But you can see there that the self and personal efforts are about 75% more efficacious than school-run, student-run, and community-based programs. And that kind of makes sense because if you are overwhelmed, you have little time when it comes to figuring out what you can do to maximize your wellness. You're not really going to be able to have a school run or community-based or student-run program available to you at that moment that you need help, whereas your self and personal efforts are always going to be kind of matched to what you need in that time. In section 3, we kind of wanted to ask, why don't they use these wellness initiatives and some of the biggest barriers to student wellness in general? And again, you see for both time pressures and prioritizing professional advancement for not using the wellness initiatives, and then for barriers, the actual stressors themselves. And so here, one of the interesting things is that when we started our wellness committee, we were thinking, okay, we need to give resources, we need to show all these different things that students can access. But if you look at biggest reported barriers, lack of information and lack of access to these different wellness programs was rated quite low. So it didn't seem like that was a big barrier. It was more of the sort of systemic problem of just not having enough time in general, and the sort of cultural element of their fulfillment kind of coming from professional advancement. And so in section 4, we're like, okay, what should we do about it? There were a bunch of different responses, but a lot of them kind of focused around these sort of themes of individual flexibility. So having counselors available, having flexibility in your schedule, things like that. One student summed these up pretty well, saying, you know, if we had time built in our schedule called wellness time or something, make SASI appointments. SASI is kind of our like mental health group here at UT, easier, more available. They say, you know, I feel like I don't feel like I have to contact the emergency line and take away from another student, but on bad days, I really feel like I need to talk to someone, but there are no appointments. So it kind of comes back to that. I kind of need help now, but it's not so serious that I'm calling an emergency line. And so it's kind of finding that happy medium where they can have options to use their sort of individual free time that they have. So in conclusion, you know, this is very much a qualitative study that's, I can't make any hard lines here, but generally it seemed like one of the themes that came out was that students are actively prioritizing their professional advancement at the expense of personal well-being. And when we were looking at the literature to see what people were talking about in terms of improving wellness, a big theme was destigmatization, but that actually didn't really come out in our survey. So maybe that's, you know, some progress. Maybe it's just not as much of an issue, but we kind of came to the conclusion that it's a baseline necessity, but maybe some more fruitful focus would be, you know, having more voluntary and active social engagements, that scheduling flexibility, counseling availability, and since students care so much about their professional requirements, having that individualized professional mentorship. And then another thing that was kind of surprising to us was that the opinions of student run versus school run are pretty similar, and that institutional efforts really need to be more individually targeted to meet students' needs. And that's it. Have any questions?
Well, I mean, happening, you have small numbers.
Yeah.
Power numbers. Banding this, knowing this is important. I think everybody, 50% of the nation go about it, you know, 15 minutes, whatever, work on maybe half a day a week or something. I know it takes away from you say professional students with a small population, also.
Right. Yeah, I mean, it's kind of ironic because we were asking students to spend like 20, 30 minutes on this really long survey. And they say we don't have enough time. But absolutely, yeah, 27 is just not nearly enough. So we're definitely working on getting more students to respond so that we can actually come up with something solid and say, I'd say something to administration about what we think the next best steps would be. Yeah. But. Mhm. So yeah, so that was actually one of the reasons why we did this survey, is that there really wasn't much data on like actually looking at the efficacy of like different programs. It was just like wellness is good and you should have it, but not anything like this is what we did or like what. So this was kind of the beginning stages of like, all right, our wellness group is not doing super well. So like, what can we do? So unfortunately, we didn't really have any like, oh, this school did this versus that.
How would you guys propose to get med students to answer a survey? No one's been able to find out.
Yeah, so I think in our sort of advertisements, it was kind of pointing out that like, we can't really make these changes. We can't offer something unless we have some sort of collaborative response. Like this is generally what the students were saying, which we also feel like is something that the wellness committee should be doing more of, is actually like aggregating that. Beyond that, I don't know. Welcome to any suggestions.
From the information that you guys collected, what do you think should be implemented that kind of meets the most needs?
I mean, I think what some of the students said was when they had like required events, like mandatory events, really were not a fan of those, given that they had such little time. Some of the other students said that at least at UT, we have like 1 day off after exams. So like, it'd be like Friday exam. And then, you know, on Sunday, you're already preparing for Monday's exam. So they were saying like having an extra day there or something, as opposed to like a mandatory session. I think having the appointments a little bit more available, which I think we do have a pretty good job here, but maybe having something like that, or like some sort of intermediate where it's like students don't feel like, oh, it has to be an emergency for me to contact this group. I don't think we had any other data.
I'll just ask one quick question. That is, what did you find most surprising about your data? We kind of did something similar with our residents, and we found that there were certainly systemic features that needed to be addressed, but for a vast majority of my residents, just making sure they had access to a Keurig that could make sure they have coffee right at the demand in the team room made a huge difference, at least in part of their wellness. I certainly don't want to simplify and say that's the whole thing, but was there things that you were surprised by as you're looking at the data?
So I love that, because I think when I was a part of starting the wellness committee, it was like, I was like, we need resources, we need seminars, we need talks, and none of that worked. Nobody showed up, and it was like, okay, well, maybe not. And then talking to like Dr. Panda and people involved, they were like, actually, it's kind of like Maslow's hierarchy. It's like, do people feel safe? Do people have food? Do people feel like they have a place to hang out? So just like very seemingly basic stuff, but kind of prioritizing there as opposed to like going to the top of that hierarchy of like, let's talk about, you know, wellness is this abstract thing. It's like, no, like most people would be happy if they had like a coffee shop they could study at. So I think to your point there, and then the other thing, just being like the efficacy of like, I would think student run programs people would like a lot more, but they're like, no, it's all the same. So that was kind of surprising too, but I don't know if there's anything.
Alrighty, thank you guys.
Thanks.